Yes, so I'll just
Fatma
highlight
number 3.
spotlight for everyone. So that's Navneet. So I'll just introduce her also. So Navneet is a very, very good friend of mine. She's an Arhatic yogi, and she's one of the sweetest person I've ever met. And she's always smiling, and she's my dentist, and she takes care of everything in my family. Also, anybody has any problem regarding anything connected to the teeth, she's one person I go to. So she has been very generous for Women's Day. She's here helping us, supporting us. So Navneet, over to you. You can take it up from here, and in the end, maybe we can have a small question answer round and everything also. Thank you, Navneet.
Sure. Good afternoon, everybody. So, as a dentist, I would want to wish each and every woman and everybody around you a very happy Women's Day because the world is being run by the women. And it is a great honor to be here on this platform and be able to help you all and maybe, highlight some important problems that everybody keeps facing but are often ignored or, get bypassed in our day-to-day lives because we are too busy looking after everybody else but ourselves. So the basic thing that I don't want it to be a very lecture-oriented session. I want anybody to, you can stop and ask me questions, and I will be more than happy to help each one of you. So the basic and foremost thing is that our regular brushing habit, how often should we brush, how we should brush is very important. So basically, if we follow the rule of two, that is brushing 2 times daily, 2 minutes a day, and always visit the dentist 2 times in a year. So this is a very basic rule, should be your thumb rule that whatever, whether you have dental problems, you're not experiencing any pain, or whatever, this has to be your regular routine. Now, when we brush 2 times a day, it is very essential that we brush after our meals. That is morning meal and your night meal, your dinner. So ideally what happens is that हम लोगों को आदत होती है सुबह उठते ही brush करने की. So that is wrong because when we eat, so whatever active ingredients of the toothpaste are, they get warded off. वो बिल्कुल nullify हो जाते हैं जैसे ही हम कुछ खाना खा लेते हैं. And the food, if somebody has gaps or cavities or whatever, it keeps sticking around in the mouth even if you rinse after your meals, which usually we don't do, but still it just keeps there and it, kind of increases the problem more. So the total bacterial count of your mouth has to be low. That is the main concept. तो जब भी आप कुछ खाते हो उसके बाद ब्रश करना है और ब्रश ओवर ब्रश भी नहीं करना है, सिर्फ दिन में 2 बारी आफ्टर योर मील. Apart from that, the 2 visits that are important for you for meeting the dentist is because कि हमारे यहाँ especially lower anteriors में बहुत easily tartar buildup होता है जो आप खुद self examine भी कर सकते हैं घर में. तो the easiest way to know if I need to see a dentist is to keep checking the tartar buildup. As soon as you get the tartar buildup, that means you need to check with the dentist whether you require a scaling and whether it is time for a scaling or if you have any cavities around. So this is a marker which is very important and this is bound to happen. ऐसा नहीं है कि आपने एक बार स्केलिंग करा रही कि बार-बार होता रहता है. ये होता है because you have salivary glands right below your tongue, and as soon as it comes in contact with plaque, it solidifies, it makes like chunks of hard calculus. So this is one way you can check if now I am due for scaling or I am due for a check. And third thing is to brush for 2 minutes. So I have a small model, I'll just demonstrate a small brushing technique because the technique of brushing is very important. So this is how, I'm going to demonstrate. So whenever you have a brush, it should touch आपका gum line and the tooth surface. It should touch the gum area and the tooth surface, not the teeth. So many times what we do is we brush like this, which is wrong. Always you have to clean the gum area in between the teeth like this in a round circular motion and keep moving forward and be very gentle on your teeth. Hard brushing doesn't necessarily mean that you are cleaning it properly. You kind of bypass all the small spots and small areas where your brush should reach and should clean. In case somebody has gaps, I will conclude the brushing technique and then tell you how you can clean the gaps also. So this is how we do upper, and the same thing we do in the lower in both the areas. So जब हम आराम आराम से करते हैं तो 2 मिनट आराम से लग जाते हैं. So you have to cover each and every surface. Then lift your tongue and then take the brush inside and do the inner area of the teeth as well. When you come in the anterior zone, brush को बिल्कुल सीधा रख के pull it down to up like this. Press it against your teeth and massage your gums and pull it up. So this is how every surface of your teeth should be covered. Similarly, we do in the upper also. Like and down to up. So we do like okay. So yeah. So now when we come to your gaps in your teeth, how to brush that. So there's something called as interdental brush which has to be used. I will also share the link or a picture in case if somebody needs it. So depending on how wide the space is, आपको वो देख के ये समझ आ जाएगा. If you can see the gap, that is a wide space. And if you feel कि यहाँ खाना चला जाता है पर दिखता नहीं है कहाँ चला गया है, is a narrow space. So narrow space and wide space brushes का set आता है that you can purchase, and after you're done brushing, you just pick it through the gaps and clean it and rinse off, and that is it. So whenever you brush, ideally, whatever chemicals are there in the toothpaste or in the mouthwash should stay in touch with your teeth also for 2 minutes. तभी उसका असर होता है. हम Sensodyne use करें या हम normal Colgate Total use करें. Anything that has to be activated in your mouth should stay in touch for at least 2 minutes. So this is the basics of brushing. Second thing that usually gets ignored and is very common in women is the bleeding gums. So women undergo a lot of changes throughout their lifetime, whether it is a teenage, whether it is a menopausal or pregnancy, or you know during pregnancy, post pregnancy, feeding, every time आपका hormonal changes बहुत होते हैं, जिसकी वजह से on and off we tend to get bleeding gums. बट ब्लीडिंग गम्स आर वन वेरी कॉमन प्रॉब्लम जो होके बंद हो जाते हैं और फिर हमें लगता है प्रॉब्लम सॉल्व हो गई. But that is not how it is. So bleeding gums will stay for 15-20 days. Body will give you an indication there is something wrong. There is some kind of infection, or I am reacting to something that is not normal in my mouth, which is causing bleeding gums. और दोनों तरह से आपको ये चीज रेक्टिफाई करनी चाहिए कि what is it collaborating with. So sometimes when girls start menstruating, उस टाइम उनको bleeding gums होते हैं, menses खत्म होने के बाद बंद हो जाते हैं. That is because your body is on an upsurge of so many hormones and you have plaque accumulation around your teeth that makes your teeth bleed. So this is a very common problem. So in case if you have bleeding gums ka issues, it should not be ignored. Commonly, another problem that women experience is PCOD. They have thyroid, they have osteoporosis. So all these problems are related to your teeth also. How? Because your teeth are surrounded by bone, which is very essential for your teeth to give strength. सिर्फ दांत अच्छे होने से दांत टिक जाएंगे लाइफ लॉन्ग, ऐसा नहीं होता. आपकी बोन सपोर्ट दांतों के अराउंड बहुत अच्छी होनी चाहिए. उसके लिए आपका थायराइड नॉर्मल होना चाहिए. उसके लिए आपका कैल्शियम मेटाबॉलिज्म, विटामिन डी, all these things should be in line. So when your body is going to be normal, everything is going to be in range, then your teeth will also stay healthy for a very long time. इसीलिए आफ्टर मेनोपॉज मेनी women tend to start experiencing loose teeth बहुत ज्यादा. एंड दैट टाइम इट्स बिकम टू लेट बिकॉज कभी लाइफ में प्लाक नहीं हटाई है, कभी स्केलिंग नहीं कराई है, विद द फियर कि दांतों में गैप्स आ जाते हैं. पर दांतों में गैप स्केलिंग से नहीं आते हैं. दांतों में गैप्स आ जाते हैं जब ये डिपॉजिट बड़े होते चले जाते हैं. व्हाट दे डू इज, जैसे दीमक लकड़ी को खा जाती है, वैसे ही ये डिपॉजिट्स आपके बोन को धीरे धीरे खत्म करते रहते हैं। इट इज कॉल्ड अ ग्रेजुअल बोन लॉस, अ क्रॉनिक बोन लॉस। सो व्हेन वी क्लीन इट, तो वो गैप्स दिखने लग जाते हैं। तो वो बहुत एविडेंट हो जाता है कि हमने जब क्लीनिंग करी तो गैप्स आ गए, बट वो गैप्स ऑलरेडी हो गए थे। So this kind of plaque accumulation, अगर regularly clean होती रहे, then you can keep all your teeth for all your life, because you know God has given you teeth to keep for the rest of the life. So there has to be no replacement if there is proper prevention. And are there any moms who want any tips for kids? I hope I have covered very basic and very quickly, so we can discuss further, and then we can have more discussions on specific issues.
So I'm pretty sure all moms would like to know how to take care of kids when they're eating too much of chocolate. Yeah, I can see some moms
So
nodding their head. Yes.
yes, this is a very obvious. I was so prepared for this. So what happens is you should not stop children from having chocolates or anything, but what we call is make it a sweet bank. Give one time of the day, preferably afternoon time, or if you have to put them to sleep, then morning time में, एक time में you fix the time when you can give them sweet. So that is the deal. That is all you have to do. And after they savor the taste and everything, and brushing after that. So the first meal can be sweet, कोई problem नहीं है. Otherwise, middle of the day can be sweet, no problem. Because eventually बच्चे ने कुछ ना कुछ खा लेना है, and वो धीरे धीरे न्यूट्रलाइज हो जाता है. Make sure within an hour the child eats something fibrous, or probably you can give water in half an hour or so, because अचानक खाने के बाद ही नहीं, तो this just reduces the acidity and the sugar content, वो थोड़ा सा wash out, एक natural rinse जाता है. Apart from that, जब हम फ्रीक्वेंट स्नैकिंग प्रमोट करते हैं कि हर 2 घंटे में कुछ खा लो, या कुछ भी खा लो, बस कुछ खा लो, दैट इज व्हाट कॉजेज मोर कैविटीज देन ओनली स्वीट्स. सो इट्स नॉट कि चॉकलेट खाने से दांत खराब होते हैं, खाना लंबे समय तक मुंह रखने से ज्यादा दांत खराब होते हैं. तो आजकल सबसे कॉमन प्रॉब्लम क्या आ रही है, दैट चिल्ड्रन आर हैविंग कैविटीज इन द पीछे वाले 4 दांत, अपर एंड लोअर, because they are watching TV or they are watching tablets or phones while they are eating, because this has become a very regular tendency of the helps कि ये दिखा दो फटाफट खा लेता है, ये खा लेती है. So they put it, so what they do, they keep chewing, they keep chewing, they keep chewing. So the amount of digestion that has to take place in the stomach, that breakdown starts happening here. अब आपके सलाइवा को तो नहीं पता कि मैं दांत को काट रहा हूँ या मैं फूड को डाइजेस्ट कर रहा हूँ. तो वो डाइजेस्टिव जूसेस बॉडी एक्स्ट्रा सिक्रीट करती है और वो डीके जल्दी होने लग जाता है. सो इट बिकम्स वेरी रैम्पेंट. So this is one point where it's not only the chocolate, it's about the timing and the duration that a child takes to eat. So if I know I am not at a place to say this, but if the child takes more than 10 or 15, or 15 minutes is more than enough to finish a meal. If the child is taking more than that, please don't overfeed them, or please do not feed them, because that is eventually going to compromise their dental health so much कि वो खाने के टाइम वो फिर च्यू भी नहीं करते, बिकॉज टूथ में पेन शुरू हो जाता है. एंड चिल्ड्रन आर वेरी नाइव, दे डोंट रियलाइज कि दर्द हो रहा है इसलिए हम नहीं खा रहे, वो कंप्लेन नहीं करेंगे. दे विल ईदर स्टार्ट ईटिंग फ्रॉम द अदर साइड, or they will just stop eating. So many a times we have faced this problem that खाना खाना बंद कर दिया है, तो चेकअप हुआ है, फिर पता चला कि दांत में दर्द था इसीलिए खाना खाना बंद कर दिया. So again, a child's dental health is also super important. There should be 3 checkups throughout the age if you are not very hands on with कि हर रोज डॉक्टर के पास नहीं जाना है, हर साल नहीं जाना है या कुछ और. So make sure कि one sitting should be at 3 years, जब बच्चे के सारे मिल्क टीथ आ जाते हैं इन द माउथ. तो रेगुलर एक फ्लोराइड थेरेपी होती है जो हम लोग सजेस्ट करते हैं. नहीं तो वी कैन ऑल्सो स्टार्ट फ्लोराइड कंटेनिंग टूथपेस्ट ऑन अ बर्स्ट ऑफ 3 मंथ्स टाइम। आप 3 मंथ्स वो टूथपेस्ट यूज करिए, फिर उसको डिसकंटिन्यू करके नॉर्मल नॉन फ्लोराइड वाला यूज करिए, फिर 3 मंथ्स वो यूज कर लो। तो उसमें क्या होता है that the child gets the necessary dosage of fluoride to keep the teeth healthy, and also it is not overdoing it, also overdose भी नहीं होता। यूजुअली बच्चों के टूथपेस्ट में बहुत ही कम फ्लोराइड होता है, which if they even swallow, it's not going to damage their teeth at all. So that is, these are two options that you can select. One is the sweet bang. Second is prolonged chewing time should not be there. And third is switch to fluoride paste. If you want some names and companies and flavors, वगैरह सब कुछ, so that also link and pictures we can share, and you can order it online. Somebody asked a question about bad breath. Yeah. So bad breath is a very common problem, and bad breath is also caused by multiple factors. So it's not only because there's something wrong in the mouth. So first visit you can do with a dentist. Probably we can check and let you know if there are any cavities in the mouth where the food is getting stuck and getting, rotten smell आ रहा है. Second is whether you need a cleaning, because cleaning regularly हम नहीं कराते हैं, उसकी वजह से भी बहुत ज़्यादा bad breath आ जाती है. Third is when you don't clean the tongue. So many times we ignore the tongue. Tongue cleaning has to be done once a day, preferably in the night time, because whatever is sitting on your tongue throughout the day has to be washed away, because we don't want any dirt in the mouth, which is, just creating that dirty smell. Apart from the mouth, there are other places where you might have some trouble where the bad breath is coming from. So we can just apprehend it's coming from this area. It can also be your sinuses. If somebody has any sinus issues, has continuous sinusitis problems, allergic reactions, asthmatic patients, also children also having some tonsillitis problems can be ruled out. जो जिन बच्चों को रेगुलरली खांसी जुकाम रहता है उनके माउथ में हमेशा स्मेल रहती है. It's not because their teeth are dirty. It could be anything that is in the throat or in the nose. Then we come down to our gut. Our gut is the powerhouse of our body, and the gut has a single pipeline to provide, your माउथ से पेट में और पेट से माउथ में स्मेल भी आ सकती है. So when we do not drink enough water throughout the day causes bad breath. If you notice sometimes, when we travel around, suddenly, odd times में smell feel होती है because हमने इतना पानी नहीं पिया. Then second thing can be a gut infection. पेट में कुछ परेशानी है, या लूज मोशंस लगे हुए हैं, या फिर कॉन्स्टिपेशन है, उसकी वजह से भी we can have the bad breath. Third thing is when we are not eating enough fibrous foods. When we don't have enough fruits throughout the day, when we do not have more fibrous food, we are more on a liquid diet, or we choose to have more of junk food and all. That can also cause bad breath, because all these processed foods have very bad smell that is coming from them. अगर बहुत ही रेगुलरली आपको बैड ब्रेथ की प्रॉब्लम रहती है, then you should see a dentist as well as a gastroenterologist, because it can be a cause of chronic gastric reflux. That can be a very big problem, because आपका जो पेट का और खाने वाली नली का जो स्फिंक्टर होता है वो खुल जाता है थोड़ा सा, तो पेट में जो भी डाइजेस्टिव एयर होती है वो बाहर आती है मुंह से, और वो पूरा दिन माउथ में स्मेल रहती है. So this is a very like detailed description, but these are so many factors that are involved with bad breath. Somebody asked how many times you should change your brush. So your brush should be changed every 3 months if you're healthy. There is no uh, past, viral infections or fever or any throat infections or something. And apart from that, in case if you come down with fever or viral infection, then the brush should be changed immediately as soon as you recover, because the brush carries a lot of virus and bacterial load over here. That is what you've been using. That is what lies there in the holder, and probably touches the other brushes as well. So that can transfer very easily. Where can I read the questions, Pyali ji? There's something else that popped.
Yes, so somebody has asked that electric toothbrushes are recommended these days. Are they worth it?
Yeah, so electric toothbrushes का rule होता है. that the electric brush should touch each and every surface of the tooth for 10 seconds. If you have the patience, you can definitely use it because they are very effective. Another thing, the point of selecting electronic brushes is the head of the brush should suit your mouth. So, as majorly we are women and Indian women, हमारा structure, हमारा face का थोड़ा छोटा होता है, तो brushes का size छोटा होना चाहिए. That is very, very important because when we open our mouth, brush यहाँ तक जाता है, पर दांत इसके पीछे तक हैं. So ideally, what you should do is when you have to reach all the way till the back, you don't have to push. You just have to put the brush, close your mouth, and then push it further. So then you can reach the farthest corner. Now, farthest corner पहुंचने के लिए अगर manual brush है, very good. If you want to use a motorized brush also, then you have to make sure that it stays there for 10 seconds. Then you shift it आगे 10 seconds. Then you shift it आगे 10 seconds so that it can do its work. Because it's a motor, वो एक बार ऐसे चलेगी, एक बार ऐसे चलेगी. उसकी X amount of rotations per minute and the pressure that you're putting should correlate properly to do it efficiently. If you're holding it properly, doing it properly, then definitely recommended. You can definitely go forward with it. Some people who have sensitivity issues, I usually tell them not to use motorized brushes because you know the intensity with which it will rotate. You might feel a little tingly sensation. वो बढ़ भी सकती है, कभी activate, reactivate हो जाती है sensitivity. So these are some things that you have to check on your own, or otherwise I am free for questions anytime. So we can rectify them for you.
So, at what age is it best for realignment of lower teeth?
So for realignment of lower teeth, age group कोई भी fixed नहीं है. From say 9 years of age, you can plan proper extractions for the correct alignment. 12 to 18 years is the ideal age to do the movement. जो braces वगैरह हम बच्चों के लगाते हैं, उसके बाद अगर alignment के लिए फिर भी आपको concern है, तो वो किसी भी age group में हो सकती है. It is not restrictive, but the only thing is the treatment plan becomes longer because your movement in a hard bone becomes slower. That is it. Movement हो सकती है. It is absolutely doable. Like I would say 9 years से 90 years की एज ग्रुप में कोई भी अगर अपना अलाइनमेंट ठीक करना चाहता है दांतों का, वो बिल्कुल पॉसिबल.
So then there's another question. Is it true that we shouldn't keep out a brush in bathroom? What's the best way to keep so that we can keep it near wash basin or in shelf or something? How to maintain the brush? Where to keep it? How to keep it?
Yeah. So where to keep it, the ideal place to keep a brush is in a holder without a cover and to be kept behind a closed drawer or to be kept away from WC and the wash basin, maybe towards the window where there is good optimum sunlight because the bristles need to be dry and sunlight to all we know is a very good disinfecting agent. हम लोग कपड़े वगैरह भी बाहर डालते हैं, antibacterial properties होती हैं. So that would be the ideal spot in case if there is no area where sunlight is not coming. So once in a while brush को भी धूप दिखा देनी चाहिए. It's very good. You
Oh,
should,
nice.
yeah, you should keep it away from anywhere that aerosols are. But washrooms usually are very small spaces. Aerosols हो गई कहीं ना कहीं जाके brush पे land करेंगे अगर वो open में है. And in case if you keep it inside a closed door, that would be ideal. And then once in a while, you can just keep it out in the sun to just disinfect it.
At what age does the wisdom tooth come? And also how to handle that?
Okay. So wisdom teeth are not a curse or anything. So wisdom teeth can be good for you in case if they're coming in a proper alignment, in proper position. We call them wisdom teeth only because uska time frame hota hai 18 to 32 years, which is a very big time. So in that time, mostly that is the time when we also gauge कि ये दांत निकलना चाहिए रहना चाहिए because उसी age group में वो formation और उसकी growth होती है. So in that case, we have to clinically also visualize and tell you how to manage them. But otherwise, if you can feel some corners or it is chronically giving you a cheek bite या खाना खाते time गाल कट जाता है या फिर उसमें दर्द आता जाता रहता है, हम दवाई खा लेते हैं, फिर ठीक हो जाता है, फिर हो जाता है। ये मतलब वी एंड अप लिविंग विद द पेन कि ये अब मैं कुछ कर नहीं सकती, अब तो हो ही रहा है, कुछ करना है। But it's better to get rid of it in case if it is chronically giving you a trouble. So it has to be managed according to what the dentist suggests. Of course उसकी surgeries थोड़ी सी invasive होती हैं because it sometimes is stuck in the bone. We really cannot help it. That is how it is, and we have to remove the bone over it to take the tooth out. And trust me, it's not that very happy thing to do for a dentist also, because it has a lot of you know post operative थोड़ी सी morbidity patient की बढ़ी हुई होती है, because patient feels कि थोड़ा मुंह खुल रहा है कम and everything. So it usually takes a week to recover. But that is with any surgery, whether be it dental or any other part of the body, your body will take at least 1 week to recover from it. So initially we suggest some soft diet, and ideal way to keep it check is again visit your dentist regularly, get your scalings done so that the problem doesn't get further. एंड इन केस इफ रिक्वायर्ड, या तो हम आपको एक क्लीनिंग प्रोटोकॉल बता देंगे कि उसको साफ कैसे रखना है, या फिर आपको ये बता देंगे कि इसको निकलना चाहिए, और इफ इट इज नॉट डिस्टर्बिंग यू, तो यू कैन जस्ट लीव इट देयर एज वेल।
Okay. I think the last question I have out here is कि कभी कभी मसूरों के पास ब्लैक लाइंस ही आ जाती है, ये क्यों एंड क्या
करेक्ट।
करें?
सो जो ब्लैक लाइन आती है वो उसके बहुत सारे फैक्टर्स आते हैं इसमें, that usually these are the stains, the food stains that our teeth pick up, and that is also because दांतों के लेयर एक होती है जो प्लाक की लेयर होती है, प्लाक पे ही आगे कोई स्टेन चिपकता है। तो दैट इज बेसिकली इंडिकेटिंग दैट आपके यहाँ पर ब्रश नहीं लग रहा है, इसीलिए प्लाक के ऊपर स्टेन्स आते हैं, एंड हम लोग क्या करते हैं, उसको और रगड़ते हैं। तो उससे क्या होता है कि दांत घिस जाता है, वो स्टेन्स कम हो जाते होंगे पर वो हटते नहीं है। तो दैट हैज टू बी रिमूव्ड विद प्रोफेशनल स्केलिंग। Again and again I'm telling why scaling is required, because we end up doing so much with our teeth which is wrong, but not do the right thing, which is to maintain it. So it's very mild, it's absolutely painless, but stains वगैरह clear उससे हो जाते हैं। चाय कॉफी के दाग भी लग जाते हैं, नॉट नेसेसरी कि कोई पान सुपारी गुटखा चुअर वगैरह। अगर आप चाय कॉफी भी नहीं लेते इतनी ज्यादा, तो भी पानी में जो आयरन के या मिनरल के, किसी एरिया में फ्लोराइड के स्टेन्स पिकअप कर लेते हैं। तो राजस्थान वाली बेल्ट में मेजरली व्हाट वी नोटिस इन चिल्ड्रन आल्सो is that they get some white spots on their teeth, which is fluorosis. That is थोड़ा सा weakened enamel structure, so they need more care. And उनकी भी cavities बहुत ज़्यादा rampantly start हो जाती हैं। So keep checking for white spots on your teeth or on your children's teeth in and around, to figure this thing out, whether they are stains or whether there are new cavities or they are due to some demineralizing issue like that.
Okay. Just one last out here is, till what age can cross bite be corrected?
So frostbite is not age related, it is basically a developmental problem. Frostbite is in that case, अब ये भी देखना बहुत जरूरी है, if it is anterior or posterior, and how far are you committed to correct it. So age is not a barrier. Again, like I told you, from 9 years to 90 years, we can correct any ortho condition. Depending on the treatment plan, it will just be a little more lengthier as compared to something that we would do in children or teenagers. It's just that it would take 6, 7 months longer than expected. That's all. You can do it at any age.
So thank you so much, Navneet. That was super. I think I myself have got 10 pointers which I had no clue, no idea about. Number one, I didn't know कि brushes को एकदम open में नहीं रखना है, उसको closed doors में रखना है. I didn't know that the paste or anything has to be in the mouth for 2 minutes. Because I think for me, brushing was simply to get that freshness. You know, नींद से
Correct.
उठने के बाद एक freshness आती है, that's it. बट उसको 2 मिनट मुंह के अंदर रखना है, ओनली देन विल द एंजाइम्स वर्क, लाइक द थिंग्स व्हिच आर देयर, दे आर गोइंग टू वर्क
Activate.
active, they're going to get activated. Amazing. And also brushing after dinner is so important. Multiple points, I think I really got it from here. So anybody else you would like to ask any question? And Navneet, can I just request you to share your number and how can people get in touch with you? Especially, here, of course, people are there from all across the world, and somebody has asked, can you suggest a dentist in Mumbai because he's from Mumbai. But
Hmm.
Calcutta में अगर कोई आपको कांटेक्ट करना चाहे तो कैसे कर सकते हैं?
So we can share my profile also if there is a group on that. And otherwise, my number is 8588001175. So if somebody wants to note it down, it is 8588001175. You can drop me
Eight
a
five
message,
double eight
00
double zero
11
double one
75.
75. That's easy to remember. So that's Dr. Navneet Kaur for you. And
Yes.
as I said, that she is an amazing person and an amazing doctor. I myself was very, very afraid of any kind of tooth things referred to, and I think she really drove my fear away. So if
Thank
you
you.
are in
My
Kolkata,
pleasure.
you can just get in touch with her.
Yes.
Apart from that, she can suggest for otherwise as well. Yes, Kanchanji.
यस एंड जो बच्चे लोग ये जो न्यूटेला के पीछे पागल हो रखे हैं आज, उसके लिए क्या सजेस्ट करेंगे नवनीत जी? दे आर
मतलब
क्रेजी आफ्टर न्यूटेला, मींस क्या स्कूल में खाएं, मींस इट्स रियली अ बिग टास्क फॉर मॉम्स टू व्हाट टू गिव देम इन टिफिन इन स्कूल.
so Nutella, like I told you, you can create a sweet bank. आप उसको किस तरीके से उसमें कंपनसेट करोगे? यू कैन प्रोबेबली गिव नटेला के साथ सम फाइब्रस बिस्किट्स, जो डाइजेस्टिव बिस्किट्स होते हैं, वो साथ में दे दिए कि ये खा के आपने ये खाना जरूर है, तो वो नेचुरली जो फाइबर है उसको क्लीन कर देगा और ज्यादा देर तक वो स्टिकी चॉकलेट माउथ में नहीं रहेगी. तो उस
थ्रेप्टिन के ऊपर
तरीके
लगा के दे दे न्यूटेला, न्यूटेला एंड थ्रेप्टिन बिस्किट.
Threptin is a multivitamin, and giving Nutella with threptin is not going to help you. Probably, जैसे Nutella ब्रेड पे या रोटी पे लगा के आप सर्व करते होंगे
हाँ
या डायरेक्ट
हाँ
खाते बच्चे.
हाँ हाँ.
हाँ, तो ब्रेड वगैरह
नहीं
के
नहीं,
साथ दे
डायरेक्ट भी खाने, वो लोग को तो न्यूटेला मिलना चाहिए, डायरेक्ट भी कोई चीज के ऊपर स्प्रेड भी, बस दे वांट टू हैव न्यूटेला इन एनी फॉर्म.
या so then टी एडिक्शन करनी पड़ेगी थोड़ी सी. आई थिंक प्याली जी
वही
will guide you on that because see again स्वीट बैंक बनना बहुत जरूरी है. Because Nutella again is a very slimy, sticky chocolate. आप खाओगे भी तो आपको भी realize होगा it sticks around in the teeth. ऐसे करते रहोगे it will still be there. So it has to be combined with something fibrous. कि उसके बाद आपने उसको कोई digestive biscuit या कुछ ना कुछ ऐसे plain biscuit you have to give, ताकि वो chew करके वो naturally उसको cleanse कर दे. Or a fruit. Ideal would be fruit. You can give an apple or maybe दो तीन छोटे 3-4 फाड़ियां ऑरेंज की दे दी, तो उससे नेचुरली क्लेंस हो जाएगा वो.
ओके.
That has to be followed. Any sticky thing has to be followed after by a fibrous food. जैसे हम लोग भी कुछ खाते हैं, कुछ चीज ही खा लेते हैं, तो उसके बाद आप गाजर या खीरा या सैलेड का एक दो बाइट्स जरूर ले लें, ताकि वो एक नेचुरली आपके दांतों को क्लीन कर देता
अरे भाई, ये तो बहुत ही मस्ती पे, तो पता ही नहीं था हम लोग को.
है.
Indeed, I myself had no idea okay, we can naturally clean up our tooth like this by eating
Yeah,
something proper. Amazing.
yeah. प्याली जी,
So,
एक
yes.
क्वेश्चन आया था फॉर येलो टीथ.
Acha. Okay.
Yeah. So, for yellow teeth, usually there are two reasons why you get yellow teeth. One is either you always had yellow teeth and you're just conscious about the look. And second is that because you think that my teeth are yellow, you brush it even more. And वो और ज़्यादा रगड़ करने से क्या होता है? Our tooth is basically made of three layers. Three layers are, one is enamel, that is the topmost and the hardest layer, which is white in color. Then comes the dentin. Dentin is yellow in color, like a sponge. जैसे हमारा बर्तन धोने वाला sponge होता है, उस color का होता है dentin. And third is the pulp, जिसके अंदर नसें और blood supply, nerve supply, lymphatic drainage सब रहता है, which is responsible for the pain and everything and sensations in the tooth. So what happens is when we are brushing and we're doing a hard brush, right, like this. So what happens is with time, enamel उड़ जाता है, वेयर ऑफ हो जाता है। तो इनामल जो व्हाइट है उसकी लेयर पतली होती रहती है, तो नीचे से आपका डेंटिन रिफ्लेक्ट करने लगता है, जिसकी वजह से आपको लगता है मेरे दांत पीले पड़ रहे हैं, मैं और क्लीन कर रही हूँ, वो और पीले पड़ रहे हैं। तो फॉर दैट, फर्स्ट ऑफ ऑल, you have to stop doing hard brushing, unnecessary brushing. Longer brushing time also is going to cause yellow teeth. Then yellow stains भी हो सकते हैं, कोई बड़ी बात नहीं है, तो उसके लिए again you have to check with your dentist. And the third thing is that after doing all of this, stopping your wrong brushing habit, getting a cleaning done, you can opt for something called as teeth whitening. But teeth whitening should not be done in cases जहाँ पर आपको sensitivity हो रही है, because it is not successful and it causes more sensitivity. So teeth whitening is like a cosmetic procedure which we usually have for models, for anybody who's more conscious, more on the screen. Pictures में बहुत dull दिख रहे हैं दांत, usually, people don't like dull teeth and they have more conversations to do, more social platforms पे होना होता है, तो उनके लिए teeth whitening is very good. Again, the product that you're using in teeth whitening is also very important. Don't go for cheaper materials. Ask for a good product which stays longer, gets maintained better, and जिसका असर भी ज्यादा समय तक रहता भी है, और उसके भी कुछ परहेज होते हैं, क्योंकि हमारे खाने में बहुत ज्यादा स्टेन्स होते हैं, टी कॉफी एंड हल्दी and all of that. So teeth whitening has to collaborate some important occasion rather than getting a regular thing done. It's not necessary to get it very regularly done. Any other questions? Yeah, toothpaste के लिए question आया था. Toothpaste, I will probably Pyali ji will share the brushes and the toothpaste के options that you can choose. I will give one for bleeding gums. I will give one for children ka cavities and prevention. One will be fluoride, one will be non-fluoride. And the third, I will give a normal basic toothpaste that you should use for general health, teeth health. That's all. And in case if you have bleeding gums, please do not use the toothpaste and stop it. You should see your dentist immediately before it stops, because that is one sign that your body gives and then tries to repair it itself. It's not that वो ठीक हो गई है, it's still there, but आपको सिर्फ एक notification आके चला गया है. So this is one thing जो often ignore हो जाता
Excuse me, Dr. Navneet.
है. Yes, yes.
Could you tell me also for, dental care for, what is it called actually? Yeah, for dentures.
For dentures, yes.
Yeah, how can we look
So
after
for
them?
dentures, ma'am, so for dentures, what we suggest is, I don't know how long have you been wearing them, but the denture checkup also should be done every 3 years. If you have absolutely, well-fitting dentures, you're very comfortable with it, still every 3 years you should check with your dentist or your prosthodontist, because there's something called as relining that needs to be done, because since your body is evolving, वो कभी कभी लूज हो जाते हैं, कभी गैप्स आ जाते हैं उसमें, समटाइम्स एक साइड से बाइट हिल जाती है या घिस जाते हैं, तो उसके लिए एक रेगुलर अपडेट होना बहुत जरूरी है. द अदर थिंग इज हाउ टू कीप देम क्लीन. यू कैन ऑल्सो गिव इट टू द डेंटिस्ट कि आप मेरे को इसको क्लीन करके दे दीजिए, तो ये लैब में जाके डी स्टेन हो जाते हैं अच्छे से, वाइट करके दांतों को अच्छे से वो लोग रीपॉलिश करके आपको दे सकते हैं. The third thing is that if you want to do a better home care, then dentures are not supposed to be cleaned with toothbrushes. Dentures को आपको soft hands से with soap and water, you have to clean them every day in running water and just rub it off like this. Make a good lather and then just wash it and then put it in the box जिसके अंदर आप dentures को छोड़ते हैं. And also, there are denture cleaning tablets that you can order online. Once a month, you can dip your dentures in that water to maintain them better for longer, so that whatever stains and everything the dentures pick up, that gets cleaned better with them. So I can share a link of the denture cleaning tablets also. Let me
Okay, that would be great. Thank you so much.
most welcome.
So last somebody has asked what to do about sensitive teeth.
Yeah. So there are many reasons of having sensitive teeth. Ideally, it should be checked by a dentist before you switch to dentist का सुझाया हुआ number one brand Sensodyne, because Sensodyne blocks the pain in the teeth, and in case if that sensitivity is because of a cavity, if it is because of a fractured tooth, it just increases the problem further, and आपको बिना pain हुए you might just end up losing the tooth. So it is very important to rectify what kind of problem it is. So in case if you have sensitive teeth, general everywhere, then it could be due to hard brushing, like I suggested, that it wears off the enamel. And धीरे धीरे जब डेंटिन एक्सपोज हो जाता है, तो कुछ भी हम खाते पीते हैं तो जनरली जो बोलते हैं कि दांत खट्टे हो रहे हैं, या कुछ भी ठंडा पानी नहीं पी सकते हैं, आइसक्रीम कभी नहीं खा पा रहे हैं, तो वो जनरल सेंसिटिविटी के लिए सबसे पहले हार्ड ब्रशिंग स्टॉप करनी होती है. And then the dentist will look at the situation, will tell you whether some lesions that have been created need fillings or can be treated with maybe a mouthwash, which is also a very slow process. It takes over 2-3 months for the teeth to absorb the correct minerals and block the sensitivity out. So you should definitely get your teeth checked in case you have sensitivity. इसके लिए कोई home remedy नहीं. But otherwise, in general, from holistic approach, once a week, if and everybody can do cold pressed coconut oil ki oil pulling, that is 2 minute minimum, maximum 10 minutes ke liye, you have to take itna sa 10 ml or maybe a chammach of coconut oil, and you have to just keep rotating in your mouth, left, right, and center, under the tongue, over the tongue, everywhere. That just gives you a lot of detoxification of the gums, that reduces so much inflammation. It is a pure source of vitamin E for your gums. So it's like a much needed facial for your gums. And I regularly suggest people to do this. What to do for jaw alignment? So jaw alignment may there are a lot of details that have to be seen, whether the jaw is deviating, whether the jaw is not opening, it is popping out, or it is paining, because this joint is like, I don't know, like the powerhouse for everything in the head neck. So, jaw related problems are correlating with your central nervous system, are correlating with your spondylitis, are correlating with sciatica, are correlating with walking patterns, are correlating with knee pain also. So how complex our body is, master knows, and everything gets related. So it's very important that you see a prosthodontist or a TMJD specialist, that is temporomandibular joint disorder specialist, or you at least go to somebody who has been working for quite some time and knows what to do with this, because usually everybody is not very well aware how to treat these problems. They usually are treated with painkillers and all for symptomatic relief, but there's a lot going on. It also depends on sleep patterns. Like I said, central nervous system is also activated because of the jaw disorders and everything. So it is a very, very elaborate study. I think now there are going to be special TMJ specialists, which are not going to be dentists, which are not going to be doctors, MBBS doctors, but they are going to be people that for disorder, because it is so complex. And I clinically need to definitely see it to tell you what needs to be done for it.
चिमणी काय केलंस?
Great. So I guess Navneet, maybe more people can connect to you if they want. If they are in Calcutta, they can definitely get in touch with you. I think Navneet has more than 4 centers, 4 chambers here in Kolkata, north, south, east, west, everywhere. So you can get in touch with Dr. Navneet. I will be sharing her details in the group as well. And you can also get in touch with her in case you need an appointment or something like that. And if in case you're not in Kolkata, if she has any contact outside, like I think I've already got two requests from Mumbai. If she knows someone, she'll definitely share the details with me and I can connect back with you. Okay. So thank you so much, Navneet. That was wonderful. I think I myself had no idea that we had so much to know about our teeth. All I need was brushing because there was enough hair. But that was amazing, amazing to know from you. Thank you so much
Thank
for,
you. Thank
taking
you.
out time for all of us. That was just amazing.
My
Pooja has a
pleasure.
question.
Thank you
She's
so much
raised
for
her
giving
hand.
me the opportunity to connect with so many people. Yes, thank you so much. I'm always ready for giving information. मुझे बोलना बहुत पसंद है. So I'm always ready for
So you're already
everybody
getting
and
so much of blessing from
everybody's
everyone.
wishes.
Thank you for this.
Absolutely, absolutely. Thanks,
Thank you for
Masters,
this
for
session.
making this
It
possible.
was really nice. I had one or two silly questions which I'm usually
Thank
very
you.
scared of asking.
Yeah.
Can you hear me?
No, no. Yeah, yeah, absolutely.
Okay. So one question is I've noticed that the top of my teeth get chipped. So I didn't realize, but maybe I'm grinding them or something. And I came across this because somebody mentioned a mouth guard online. So is that something that'll help me? Like I have
Correct.
issues uh with with proper closure of my mouth sometimes, and sometimes I feel like over the years I felt like my upper jaw has kind of protruded, and that made a big difference to my smile or closing of my mouth or whatever. But I don't know if these two are connected, but I was wondering if I should think of a mouth guard when I'm not outside the house or something like that, or figure out how to keep my mouth, like I can't place it shut properly, like they are not in one line.
Yes. So, there are a lot of questions that I would want to ask, but since the time is pressing, I would want to definitely suggest you a night guard, and it should be made to order. Please don't order it online because that can further increase the problem. It has to be somewhere around 1.5 mm, and it should be soft to start with. The second thing is try to wear it towards the night time. Try to relax your muscles with something warm around your TMJ before you go off to sleep, or maybe if you can take a saltwater bath that calms your whole body down, and lukewarm water से थोड़ा सा cool down मतलब आराम करके फिर then if you go to sleep, that would be very very ideal, because something that you are telling are definitely joining dots for a TMJ disorder which develops because of grinding. Chipping off of teeth is a very important sign that tells us that your teeth are undergoing excessive pressure. So excessive pressure जब दांत नहीं ले पाते, your teeth are supposed to be in contact with each other for maximum 10 minutes a day. So that would be maximum during chewing time. And this is very strange for each one of us to understand कि दांत आपस में जुड़ने नहीं होते. But जब भी आप बात कर रहे होते हो या your teeth are at rest, your jaw is at rest, they should not be touching. So in case they are like this also, when you're working, that means you have a clenching habit. Your muscles over here are over tensed, overactive. That is causing this to happen. But since I told you body is a very complex structure, you might be doing it out of stress, probably not out of stress, maybe because of some other issues that you have. Could be a vitamin deficiency as well, could be osteoporosis that is causing your jaw to dislocate, not place properly. Yeah, it is popping out. Again, it is correlating with a lot of TMJ issues. So to start with, yes, you can definitely go for a mouth guard, but it's too vague to just, diagnose the problem over a call without even seeing it clinically. Uh, Ordering a night guard over, online and everything is also not recommended. But it's better that you get it done in a dental setup where a proper size and bite and your alignment के हिसाब से वो बन के आए.
So, ma'am, do you do on like consultations on call if I'm not in the same city? That I would like to just investigate this first with you and then maybe take it forward later somewhere else locally.
No.
Hello. Hello.
Navneet, we can't see you anymore. I believe there's an issue with her internet, maybe. So,
Ma'am, could you send her number? Ask her if she does
sure,
preliminary
sure, sure,
consultation on phone.
sure.
Thank you
I
so
shall
much for
definitely do that.
connecting us.
Yeah. Most welcome. I should
Thank you.
definitely share Dr. Navneet's number in the group itself and also her chamber details. If in case you want, you can get in touch with her. Okay. Thank you, everyone. Thank you so much for joining. Take care of yourself in advance. Happy Women's Day. And more sessions are coming up for women, for my beautiful women, and of course, their counterparts. So stay tuned. Take care. Bye bye.